The coronavirus has now claimed nearly 500,000 lives across the U.S. The nation is set to surpass the staggering milestone today, with the real total likely higher. It's more than double the amount of deaths recorded in any other country. So tonight, the White House says that President Biden will honor those who lost their lives with a candlelight vigil, or a candlelight ceremony, rather. The president will be joined by the First Lady, Vice President Kamala Harris, and the Second Gentleman.
So, as we say, we are digging into this. Let's bring in Dr. Ron Elfenbien. He is the medical director and the owner of First Call Medical Center. So, Dr. Elfenbien, just a grim, I know that it's a cliche now when we talk about the coronavirus to use those terms, grim milestone, but the numbers are grim, and it is horrific to realize that 500,000 people have died. And, the Washington Post has a really interesting graphic to help people visualize what those numbers actually mean. And I went through it this morning, and in one of them, it's so stark because it sort of imagines that if you think of January as the deadliest month of the pandemic, an average of 3,100 souls died every single day because of COVID-19. A caravan of buses containing that many passengers would span more than half a mile. So just trying to visualize that is remarkable. And here you see this graphic. The death toll exceeded the American combat deaths in the First World War, the Second World War, Vietnam, Iraq, and Afghanistan. So back in March, at the start of the pandemic, Dr. Anthony Fauci had said that 100 to 200,000 Americans could die from the coronavirus. I remember back then, as this morphed into something political, less of a public health crisis and more of a political crisis, that people would tweet at me, "Stop fear-mongering, stop scaring Americans." And now here we are at 500,000. Here's what he had to say about where we are on CBS This Morning earlier.
Back in the late winter and early spring of 2020, when we gave the modeling number of 240,000, people thought that we were being hyperbolic about that and somewhat alarmist. And clearly that was not the case. This is a horrible landmark that we've now reached. And even though the numbers are coming down, as you've shown on the deflection of cases and hospitalizations, we really can't declare victory quite yet, because we have vaccines that clearly are the light at the end of the tunnel.
Dr. Elfenbien, Dr. Fauci has been criticized by many people, some on the left, some on the right, because he is so often cautious, or when he throws out numbers like the ones that he did early on in the pandemic, people say he is fear-mongering. Today on CBS This Morning, he was sort of asked about that. And does it make sense to you as a doctor that he would say, for example, when Gail asked him, would we possibly continue to wear masks into 2022, that his response wasn't, yes, we absolutely will, but hey, there's still a lot we don't understand about this virus, and it would be wrong to say, absolutely, we won't be wearing them. So to say cautiously that we might is probably better to err on that side. I don't know how you see it.
I totally agree. And Vlad, that was, you're right. It's very hard for people to put into perspective what 500,000 means. I mean, it's just a number, and it's very somewhat arbitrary to our minds. We can't really picture that. It's very difficult to picture. If I said picture 100, probably could do that in your head. But 500,000, 1 million, these very large numbers are very, very difficult for our brains to process and to put into true perspective. So I really appreciate you bringing that forward with the bus analogy, because that actually puts it into someone's, you can actually visualize that in your head. I think Anthony Fauci is a very, very smart man. He's done a tremendous job. And I totally agree with him being cautious like that. I mean, we don't know. We can't answer that question. And I think he did as best he could in answering that question. And I don't think saying no would be smart. I don't think saying yes would be smart. So I think kind of couching that answer a little bit, while maybe some would say it's a little bit political, but it's the right thing to do.
Well, one of the things about the numbers is it's really difficult to determine what to focus on. Which numbers give us a clear snapshot of where we are with this fight. So we have this 500,000 deaths, which is staggering and heartbreaking. But we also have these other numbers. Cases are going down. Hospitalizations are going down across the country. Some experts say that the country may be turning a corner. Based on some of those numbers, Doctor, what's your take on it?
Well, I'm gonna be a little bit Fauci-esque, I think, in my response here, and say that it's great that these numbers are going down, and I think that that's a very positive sign. But I would caution everybody to say that I don't know that that's the light at the end of the tunnel. I don't know that we're done, because this virus has proven time and time again to keep rearing its ugly head and kind of keep coming around us from the sides and outflanking us, and we could just be on the downturn slightly. And then, another spike can pop up. So we don't really know for sure. Hopefully, obviously, these numbers will continue to drop and in terms of sickness, infections, and hospitalizations. But I think it's a little bit premature to say that. I know there was an article I believe it was in the Wall Street Journal by a physician at Johns Hopkins who claimed that we're going to be done with this whole thing by April. I think that's very, very optimistic. And I would caution people to say that, that's obviously a goal, and I would hope that that's the case. But I don't necessarily buy into that, and I think that we just need to kind of be vigilant and stay vigilant.
Yeah, and now when you couple the fact that you have a lot of people, we talked about this, Dr. Elfenbien, that are skeptical about the vaccine. There are many people who are receiving misinformation. It just sort of portends for continued. I mean, the specter of this pandemic doesn't go away just because the vaccine is going to be readily available, as President Biden says, by the summer for anybody who wants it. And Dr. Fauci on Sunday said that high school students could potentially get vaccinated against COVID-19 when they return to classes in the fall. The question for the parents of elementary school students is, when could they possibly get vaccinated? Just personal experience. I know my sister yesterday said that both of her kids are scheduled to get the vaccine. One's in high school and one's in elementary school.
So the vaccine right now is FDA authorized for 16 and above. So they're doing studies right now, and they're looking at the efficacy of the vaccine in children under 16. So I think that has to continue. We have to wait to see what those results will be. But there's no reason to doubt that it's going to be any more efficacious in children than it would be in adults. Obviously, there's an old saying in medicine: kids are not just little adults, and that's the truth. They are their own. That's why there's a specialty called pediatrics. They're their own sort of entity. But there's no reason to suspect that the vaccine will be any less efficacious in children, again, than it would be in adults. So I think these studies will pan out, and we should be able to vaccinate everybody by the fall for sure. But again, we got to remember that just because even if the whole world gets vaccinated, this virus isn't going to go away. There's still going to be pockets of it. There's still going to be people that will get infected with it. Again, the vaccine is just to keep you from getting sick from it, not necessarily keep you from getting infected with it. So, the virus isn't going away. This is going to be with us for a long time, possibly for the rest of our lives. So we got to remember that, and we have to, again, be vigilant.
A very good reminder, Dr. Elfenbien. Thank you very much.
Thank you, guys.